All right, today we're diving into a really cool piece of biological engineering called the sinus lift. It's this amazing fix for a problem that, believe it or not, keeps a lot of people from getting that perfect permanent smile. So let's get into how it all works. So let me ask you, have you or anyone you know ever lost one of those upper back teeth? A molar or maybe one of the premolars. You'd probably think, okay, just put a dental implant in there, right? Simple. But it's often not that easy. See, nature has a little hidden challenge waiting, a kind of anatomical trap that your surgeon has to solve before they can do anything else. And that gets us right to the heart of the issue, a process that starts happening quietly the second a tooth is gone. I'm talking about the vanishing jawbone. As soon as that tooth is out, your jawbone is suddenly under a two-front attack. Seriously. From down below, the bone isn't getting stimulated by a tooth root anymore, so it just starts to shrink back. That's called centripetal resorption. But at the exact same time, from above, that air-filled sinus cavity starts to expand downward into the new empty space. It's really a perfect storm for bone loss. So what's the bottom line? Well, it's simple, and it's a big problem. The space between the floor of your sinus and the top of your jawbone gets smaller and smaller until there's just not enough solid bone left to lock in a dental implant. Now, to really get how we fix this, we first need to understand the main character in this whole story, the maxillary sinus itself. So what is this thing? Just picture a small, air-filled room that sits right above the roots of your upper back teeth. It's kind of pyramid-shaped, and it's actually the biggest of all the sinuses you have. It's the floor of this room that we're really focused on. And lining this room is something incredibly important and incredibly fragile. It's called the Schneiderian membrane. The best way to think about it is like biological wallpaper. It's super thin, it's delicate, and the entire success of this whole procedure hinges on keeping this membrane perfectly intact. Okay, so you've got bone shrinking from one side and the sinus expanding from the other. How on earth do you build a stable foundation in the middle of all that? Well, this is where the sinus lift comes in, and it is a truly elegant solution. So what is a sinus lift, right? At its core, it's a construction project. It's a bone augmentation surgery. The surgeon's whole goal is to carefully lift that delicate wallpaper, the sinus membrane, upwards, creating a brand new space, and then fill that space with new bone material. So what do they use for these building materials? Well, there's a whole menu of options. They can use what's called an autograft, which is actually your own bone taken from somewhere else, or an allograft, which is donated bone. There are also xenografts from animal sources, or even synthetic, man-made materials. And a lot of times they'll add in growth factors to basically kickstart and speed up the healing. Okay, so that covers the what and the why of the sinus lift. Now let's get to the how. When it comes to actually doing this, surgeons basically have two main paths they can take. And the choice between them really comes down to one big question. How much bone do you have left? If you have very little, we're talking less than 5 millimeters, they'll need to use the lateral window technique. It's more invasive for sure, but you can build a ton of new bone height with it. Now, if you have more than 5 millimeters to start with, they can often use the less invasive osteotome technique. So just so we can see how the whole process works, we're going to focus on the more complex one, the lateral window approach. So this lateral window technique happens in 3 really precise steps. First, the surgeon makes a little opening, like a tiny trapdoor or a window on the side of your jawbone. Step 2, they work through that window to very, very gently lift up that delicate membrane. And finally, step 3, they pack the bone graft material into that new space they just created. Now, as with any surgery, this isn't risk-free, and the recovery process, well, it really requires you to be an active participant. So let's talk about what you need to know. Okay, the most common complication, by far, is a tear in that super delicate Schneiderian membrane we keep talking about. It's just so fragile. In fact, studies show this happens somewhere between 20 to 44% of the time when using this lateral window technique. But here's the thing you have to remember. Surgeons are totally prepared for this. They expect it might happen. For really tiny tears, they might not need to do a thing. But for bigger ones, they have a special collagen membrane they use to patch the area, kind of like a tiny little Band-Aid. And a lot of the time, they can just continue with the procedure right then and there. Your own individual anatomy also plays a huge role in the outcome. That's why they do a CT scan before the surgery. They're basically doing a pre-flight check. For the best possible result, they're looking for things like a nice thick membrane, no little bony walls inside the sinus, and of course, having more than 4 millimeters of bone to start with is always a plus.
Your recovery it's absolutely critical for success. You'll need to use ice packs and sleep with your head propped up to keep the swelling down. And then there's the don't list. For about 3 weeks, you have to avoid anything that creates pressure changes in your sinuses. That means absolutely no straws, no smoking, no blowing your nose forcefully, and yeah, even no flying or swimming.
So after all that, what's the big payoff? Well, over the next 4 to 12 months, something pretty incredible happens. That bone graft material actually becomes a part of you, transforming into a solid, dense, living foundation of brand new bone.
And that new bone, that is the whole point. It gives you that strong, stable anchor that's needed to place a dental implant that can work just like a natural tooth and hopefully last you a lifetime.
So next time you hear about someone getting a dental implant, just remember this amazing biological construction project that might have had to happen first. And it makes you wonder, right? Could this clever solution be the key to rebuilding not just a single tooth, but someone's entire smile and their confidence along with it?